Good afternoon, everyone. Thank you for joining us again live on LCTV as we give you our Niagara County COVID-19 updates. I'm Becky Wittes, Chairman of the Niagara County Legislature. We're currently streaming live on lctv.net and also on 90.9 FM on your radio. I hope everyone had a wonderful 4th of July weekend, that you were able to celebrate and have fun, but that you also did so while following those safety protocols that are still so important to us. I'm joined again today by Dan Stapleton, our Director of Public Health here in Niagara County. And Dan, why don't you go ahead and just start us right off with our latest COVID-19 statistics?
Sure, Becky. Thanks for having me. We have 34 new cases since our last report on Thursday. That brings our total of positives to date to 1,295. So we continue to see new cases every day. But we are down to 67 active cases right now. We have no one who's being isolated in the hospital right now, which is a really good thing, and everyone is isolated at home right now. 1,138 people have recovered so far, which is also a very important number as well. Unfortunately, we have one more death to report of a female who died over the weekend from COVID, and our thoughts are with her family. So continue to see cases, but these cases are also directly related to assisted living facilities. So over half of those cases, the new cases, are either staff or residents of nursing homes, and that's an important characteristic as well. It shows not necessarily a community spread, but a lot of cases tied to one facility, which allows us to directly mitigate that outbreak and bring it to a close quicker and earlier.
Okay, Dan, I know, even though it was over a 4-day period, 34 does seem like a bit of a spike. You talk about nursing homes. Tell us a little more about that. I know the governor talked today about nursing homes as well on his briefing.
Yes, a while back we saw a number of cases. For example, Newfane had a lot of numbers, much larger than you would expect for a community of 9,000, but over 80% of those cases were tied to one facility. We're seeing that now with a facility in North Tonawanda that has an unusual amount of staff and residents who are testing positive. The good thing about that is more testing is being done in nursing homes, not only by residents but also staff. Staff are tested every week to make sure that they are negative. So that allows you to identify that case quickly before it spreads to the residents.
Okay, and these cases in the nursing homes, of course, are unfortunate, but if we factor those numbers out of our overall totals, it does appear as though that we are in line with where we want to be for our overall general population.
Absolutely.
And of course, the Niagara County heat map has been updated again today with our new numbers. You can continue to watch those numbers on niagaracounty.com at the top of the page in the COVID-19 banner. Again, this heat map will break down those numbers of positive cases that have occurred over the last several months by municipality, so you can see which towns and cities those numbers are happening in. We've seen over 362,000 views of our county heat map so far, so we do know that those numbers are important to you and that you're watching them. And we will, of course, continue to update those each time that we get new reports. I want to switch to testing now for a moment, and according to state data, we have now had 36,218 Niagara County residents that have been tested for COVID-19. Again, you can find a link to this state tracker on our Niagara County website as well. And Dan, last week we mentioned that the Niagara County Department of Health is starting drive-through testing on Wednesdays. How is that going?
Going very well. We've been doing that testing for a while now. It allows us to be able to, when it first started, it was for first responders, healthcare workers, pregnant women. That was because we had a limited supply. Now that the supply of testing kits is much more readily available, we're opening it up to all Niagara County residents. It allows you to be able to go there. The test results usually take about 2 to 3 days, sometimes shorter, which is a tremendous turnaround. So it's a great opportunity for people to get tested. We ask that people call our nursing division to register. We have people pre-register so they can come through quick, easily. The number is 278-1900. That's our nursing division for the Niagara County Department of Health. We're finding that those numbers are working really well. People are able to go through and might do as many as 50 a day, but the ability to be able to identify a person, especially in a nursing home, healthcare facility, corrections officers, or public safety officials, allows us to be able to do that right away and get those people identified, whether they're positive or not, and make sure that there's no spreading of the disease. So that's been working really well. We're very proud of all the work our staff do with that.
And Dan, do you need a prescription from your doctor to attend that county site?
No prescription necessary. We're using the standing orders from Commissioner Zucker from the New York State Department of Health. So no prescription for your doctor is required, just the pre-registration.
Wonderful. And if that Wednesday morning testing site is not one that you can get to, again, we do have the list of all the testing sites available on our Niagara County website for you with the registration numbers to call and all the information that you need. We, of course, encourage you to keep getting tested, especially if you do have symptoms, of course. As more people are out and about now and going back to work, more businesses are reopening, it's very important that we keep doing this testing. In fact, the governor told us today that New York State has the capability to do about 60,000 tests a day. And this testing, of course, allows us to monitor what we call our infection rate, or the rate of tests that come back positive. Dan, what are you seeing as far as our infection rate and the data there?
Well, with our ability to do this since Thursday, we've done 2,000 tests for Niagara County residents, great numbers. So our infection rate remains at 3.5%. Today, it seems to drop almost every day, which is a great thing. The average, it's less than half of the rate for the rest of New York State, excluding New York City. So we're very happy about that. Our daily rate, anywhere between 0.5% up to 2%, but we're averaging around 1%, which is a really daily infection rate that we're really happy about. And that's something we watch every day. It's going to hover right around that. If it goes up dramatically and it has a trend, then we'll need to respond and make sure that we're doing everything we can. But right now, our numbers are good, and they're going in the direction we want them to.
Great. And of course, the other metric we look very closely at is hospitalization rates. Last week, there was talk of a slight uptick. You'll see the graph on your screen. The blue is all of the hospitalization rates for Western New York, with the yellow being ICU rates. So again, from what you see on your screen, a little bit of a blip as we look back. Dan, thoughts on what we were seeing there, whether that's a concern to see that minor uptick there for a few days?
Now, I think you look at trends. I think you look at trends for maybe a week or so to be able to identify whether something's changing. But right now, our hospitalization rate is absolutely tremendous. The thing we were worried about right from the beginning is making sure our hospitals weren't overwhelmed by the surge. And due to work of a lot of people, including the residents of Niagara County, we're able to see that flattened it out. The hospitals weren't overwhelmed, and that's an important thing that we're really proud of. So a day or two, not a concern of mine, but an over trend of maybe a week, we'll have to make sure we're doing everything we possibly can, and remind people to make sure they're doing the things: social distancing, the washing of your hands, using hand sanitizer, and using your masks. I know people are getting tired of hearing that same message, but when something works like this, you can't say it too often.
That's right. And important to note, of course, that graph that we showed you was for all of the Western New York region that we're included in. But the great news is 0 hospitalizations here in Niagara County currently, which is great to hear. Now, of course, all weekend long, all of last week, we were hearing story after story of COVID-19 running rampant in other parts of the country and other states, seeing, very large upward trends. What are your thoughts there?
Well, my opinion is we need to make sure we're doing the things we need to do. We do know that until there's a vaccine, these are the things we're going to need to do. Because the belief is we won't have a vaccine readily available until sometime, maybe the second quarter of 2021. We need to be able to do these things consistently over time. Whether or not places open too early or not isn't for me to decide. But I can tell you the things we're doing now are working, and we want to make sure we don't go in the opposite direction, because right now things are going well. People are doing a lot of hard work, and we don't want to take their actions for granted, because it's keeping us all protected.
Very true. And I think, it struck me today when the governor talked about the fact that as we reopened, even though we were doing it slowly, we were doing it carefully, there was an expectation that numbers would start to go back up, that was inevitable because we were bringing more people together and closer together. And that simply hasn't been happening. We actually have been on that continuous, steady, downward, good trend. So again, I think it's important to note, we can't say this enough, keep following those protocols. What we're doing is working, and we want to be very careful not to get ourselves into that situation of having to take a step backwards again. So one last question. There's still so much question about the schools. The governor mentioned today there still has not been a decision made about schools reopening in the fall, but that all schools have had to submit a plan to the state on how they feel they could do so safely, or what their plans would be, new protocols that they would put into place. And he's going to use those plans to help make the decision, along with the data, about what will happen in the fall. I know that you've been talking very closely with our local school districts as that planning takes place. How are they working their way through this process?
Well, I'm very happy that they've invited me to have conversations with their entire group. I talk to superintendents on a weekly basis. The thing I'm telling them is I give them advice about what they need to consider, things that they can't necessarily think about. My expertise is public health. Their expertise is education. So being able to bring those 2 points of view together, I think, is really key. But they're really taking this serious. There's many options they're looking at, and I think depending on the age of children, is an important thing to consider. Also, if we're reopening our economy, we need to make sure people can get to work, and they can't get to work if they have to worry about someone watching their children. So I think they're taking all those things into respect when they're making those decisions. But I can tell everyone they're not taking those decisions lightly. They're talking on a regular basis. They have groups that they're meeting with on a daily basis to talk about what can we do to make sure the education a child is provided is really working for them. We do know that the Academy of Pediatrics says we need to make sure the children are better off in school to learn. The remote environment doesn't work for everyone, but is their ability to have the older children who are more used to social distancing, wearing masks, and having them at school versus a young child who can't follow, either can't have the mask on or won't keep the mask on. So I think they're taking all those things into consideration. I'm really pleased that they asked me for my advice and that we're working hand in hand with them on a weekly basis, because those partnerships are invaluable.
Absolutely, and like everything else, it's such a delicate balance as we open things back up to do so safely.
Absolutely.
So thank you, Dan, for being with us again. We appreciate the information, of course, as always.
Thanks, Becky.
The governor told us also today that casinos and movie theaters will continue to remain closed for the foreseeable future. We will, of course, update you as we hear more about new reopenings in this last phase that we're in, because we certainly now know that Phase 4 did not mean a light switch where everything goes back to normal. There will certainly be different guidelines that will come out from the governor's office as we move forward. A few other notes. I want to take a moment, of course, to thank our staff of our Emergency Services Department for their most recent public giveaway of masks and hand sanitizers. We gave away 7,000 bottles of sanitizer and 10,000 cloth masks in just a few hours. These have been wonderful drives. Clearly people are wanting and needing those items, so we hope to continue to receive large quantities of those things from the state so we can continue to hold these drives for you. Make sure you're watching our Niagara County Facebook page. We will get that information out by way of media release as well once we hold more drives. Last, I also want to remind you that all playgrounds in Niagara County parks are now reopened. Our team at Public Works is giving all the playgrounds a good cleaning once per day as indicated on the signage. Crawl Park Splash Pad and Oppenheim Park Splash Pad are now both open as well. There are, of course, temporary COVID rules in place, and those are marked on the signs at the entrances. So make sure that you're reading those so you understand the new rules that are in place for your safety and your children's safety. I also want to note that all restrooms are open on the weekends to accommodate our shelter rentals. However, during the week, some of those restrooms will be closed due to staffing issues so that we're able to keep them as clean as we need to at this time. There's, of course, a lot more work right now being required of our Parks Department staff. We certainly appreciate all of their efforts and hard work with all of these new cleaning protocols that are in place. So thank you all. I want to remind you again of our Niagara County Crisis Services Hotline as well. That's 24/7 free and confidential help for anyone who might need it. Their number is 716-285-3515. They're there for you no matter what you are struggling with. If you yourself or a loved one is dealing with hard times right now with the uncertainty of everything going on, whether it's financial worries and concerns over loss of a job, health of yourself or a loved one, all of those things that we're dealing with during these uncertain times, please reach out to them. They are there for you. 716-285-3515. If you missed us or joined us late today, you can catch us on demand on lctv.net. They'll put a link under the Niagara County Legislature tab so that you can watch this broadcast at your convenience. We'll also have that link on our Niagara County Facebook page as well. We continue to thank LCTV for the wonderful partnership during this time as we get our information out to you, and all of the other broadcast companies who have shared our information as well. We'll be back again next Monday for another Niagara County COVID-19 update. For now, stay healthy, Niagara.